and a lot of institutions funding research on social justice, social indicators of health, and things like that. It's become such a hot topic, and it should be. But again, what took us so long? What took us so long to think about the racism in nursing, really?
Hello, everyone. I'm Angela Rosa DiDonato.
And I'm Marian Leary.
And you're listening to Amplify Nursing, a Penn nursing podcast supported by the Panola Fund for Innovation in Nursing.
Amplify Nursing features nurses who are leading the way in science, policy, and innovation.
Our guests defy stereotypes, define practice, and disrupt convention.
We highlight the breadth and depth of nursing influence on society by amplifying nurses who are pushing boundaries and breaking down barriers to build a new paradigm. Today on the Amplify Nursing podcast, we talk with Dr. Julie Fairman, Professor of Nursing at the University of Pennsylvania School of Nursing. Dr. Fairman is a renowned nurse historian who's made significant contributions in studying how 20th century healthcare issues have influenced current nursing and healthcare trends. Her remarkable career has sparked a new paradigm for studying the history of healthcare and health policy, and her current research focuses on the civil rights movement. Dr. Fairman talks with us about the nuances involved with studying the history of healthcare, the role of nurses in addressing structural racism, and how historical perspectives shape the landscape of healthcare practice and policy today.
So, Julie, thank you so much for coming to talk to us today.
Well, thank you, Angela, for having me here. It's really always great to talk about something you really care about.
Yeah. So why don't we start by talking just about what brought you into nursing?
So I went to college thinking I was going to be a forest ranger. And my father wanted me to be a secretary. It was a good occupation for a girl. And my mother really is the one who encouraged me to go to college. So I went to college. And, I guess, I don't know, maybe the Vietnam War was really sort of winding down then, and you were seeing all these young men in body bags and things like that. And I thought, maybe here's someplace I can make a difference. I think that was always something I really wanted to do. I grew up in the woods. I grew up in the forest, and, that was just like a really happy place. But being able to care for injured soldiers or care for really sick people, after my grandmother got sick, was really some of the things that drove me there, I think. So after the first year, I really switched into nursing and never looked back.
That's great. So how did you end up doing what you do now?
So when I finished my baccalaureate program, I went to Penn to work as a nurse. My first time maybe the second time I've ever been in a city. I grew up in a very small rural farm town. So I went to work in the ICU and I loved it. But I felt like I really needed some additional skills to really work as well as I wanted to. And at that time, the idea of a clinical nurse specialist and a nurse practitioner was really beginning to gain ground. And I thought, I would really like to do that. I always like to work as independently as possible, which is probably why I like history. So I went back to Penn, and also they were paying full tuition at that point.
Wow.
And so I went back for my master's degree. It also was the time of nurse traineeships and master's programs. So my whole education plus a stipend was paid. And then I happened to be sitting next to Joan Lineau at a luncheon and said, I really would like to get into teaching and I like research. I was working then as a clinical specialist in a kidney transplant clinic, and it was a great job. I was following about 500 transplant patients, and, physicians aren't also always so happy to work in clinics and to work in the outpatient realm, especially surgeons. Mm-hmm. And so I was pretty independent. So I thought I would do my dissertation on adolescents who stopped their transplant immunosuppressant drugs, because we had a whole handful of them who were doing it at about the same age. What was going on there? I mean, we knew what was going on, but how can you prevent that? And I was sitting next to Joan Lineau, and I said, I'd like to do that. And I said, but what I really love is history. My dad and I would talk about history books. We'd watch history things on TV. And I said, but I know you can't do that in a PhD program in nursing. And she looked at me and she said, well, why not? because I didn't think he could do it. And who I was talking to was somebody who herself had gotten her PhD in history at the University of Kansas and had been brought in to start not only a nurse practitioner program at Penn, because she's one of the foremost and earliest adapters of the nurse practitioner model in nursing education, but also she started at the Barbara Bates Center, which wasn't called the Barbara Bates Center then. She created a relationship with Charles Rosenberg and Rosemary Stevens. It was very collaborative across disciplines. And so that's how I really came to where I was. And she happened to have gotten a query from the American Association of Critical Care Nurses who were interested in having their history written. And so as a doctoral student, she brought me along because I had been a critical care nurse, right? That was my dissertation, a history of critical care. Now, the association wanted an association history, but what Joan was really astute at doing was to make sure that this was not just a history, a celebratory history of the organization, but also a history of how we came to have the most expensive care in the United States through critical care units. And that was my dissertation in my first book. That's it. That's why I got my PhD. And then I was lucky enough to get a postdoc with the History Center. And then I went into an assistant professor role at the school. And I've been here for a very long time.
I think it's so interesting to me how many people have these serendipitous things that happen that bring them to where they are. And so many people say it's like the best thing that ever happened to them were these chance conversations and things like that.
Yeah, I mean, I've had that all throughout my career. For example, I was, an assistant professor. I just got promoted to associate professor. And I was thinking, what's next for me? I did the critical care book. I was writing about nurse practitioners. I really like this policy angle because it's all historically grounded, right? Depending on what lens you use. And so I had a conversation with Mary Naylor. And I said, well, how can I get more into the policy arena? And she said, right now, what was then the Institute of Medicine is convening a committee on the future of nursing. And the American Academy of Nursing, American Nurses Association, and the American Nursing Foundation was sponsoring a scholar in residence at the IOM. And so she suggested I apply for that. And I did. And I was given that particular fellowship. I mean, to me, that was serendipitous. And I do remember I was interviewed by Sue Hassmiller, though I don't think she admits to this. And she said to me, why do I need a historian for this committee? This was, was headed by Donna Shalala and Linda Burns Bolton. She says, what do I need a historian for? We're looking to the future. We're not looking to the past. And so we had a long conversation where it's not that I convinced her, but I think I probably put forward a pretty good justification for why the committee needed a historical perspective. Now, I wasn't a committee member. I served as staff to the committee, which actually is a pretty important position because that's where a lot of the work happens. That was one. The other one was I was giving a talk, the heck was this, in Washington, D.C. Mary again couldn't go. It was on, I'm trying to think of Christensen's name, disruptive innovations in healthcare. And I talked about nurse practitioners and, gave my little spiel. I was the only woman on the panel. It was all these people who were doing apps and devices and tech and all that kind of stuff. And I'm the only woman, the only nurse. And I talked about competition and how, the Federal Trade Commission, it was one of the first recommendations coming out of the Institute of Medicine report was that the Federal Trade Commission should look at anti-competitive practices. And so after I gave my talk, a gentleman walked up to me and he said, I'm Dan Gilman and I'm the one who writes the advocacy letters to states when they're opening up their nurse practice acts. And I totally agree with you. So he and I went on to this really nice writing partnership. We published one article. He was on Ashley Ritter's dissertation, which was great on collaborative agreement, legally required collaborative agreement. So those are two really interesting ways that serendipity. I didn't go looking for that, I didn't go looking for these things, but they were there and I took advantage of them. And I think, you can do all the planning you want to, in terms of your career. You can build up your publications, you can build up your funding portfolio, but sometimes it's just, you have to be able to grab what comes down the road to do what you like doing.
So what were some of the things that you enjoyed doing the most?
In terms of history or in terms of career in general? Or
in terms of history?
Mm-hmm. I love the research. I do. I love it's funny. I call it the hunt. I love the hunt for resources and for data, looking at trying to find, that little piece of data that really just ties everything together. To me, that's the most fun about it, in a sense. It's the hardest thing too, because, many times, for example, archives are very political. For example, they will they keep what they think is important and they prioritize what they think is important. That's structured on race, class, gender. And so when you go looking for things, nurses were not always considered the highest priority for many of these archives. And you really, really have to dive deep. So I just found my current work is looking at women as civil rights activists, and women as activists generally, using the 60s, 70s, and 80s as a really sort of time period. And, I found some nurses in the civil rights movement. And I also found nurses in the West. Nobody has written about really nurses working in the West as rights advocates, and in the Midwest and in the Southwest. And I have found a nurse that worked with Cesar Chavez. I found oral histories of two nurses who worked in California with, I believe it's Henry Rival, who started the Hispanic Congressional Caucus. They're out there, but they don't have their own repositories. They either didn't think about saving their own records, perhaps didn't want to save their own records, and other places didn't see it as important to save their records. So it's really hard. So it's not just there where you just walk in and say, oh, look at this is great. I have all these records. It's like being an investigative reporter, trying to figure out, where your sources are, what they mean, and setting them in the context of the time period. That's what I like.
It sounds like a lot of fun. It sounds like a lot of hard work. Honestly, it's probably very tedious at times, because I'm sure it's like finding a needle in a haystack when you're looking for information that isn't, for example, like you said, you're looking for nurses and it's not a repository of information on nurses. You're looking in other places, trying to find them.
If you do history well, it looks easy, but it isn't easy. It's, you're creating a story out of wisps of information sometimes, and you have to speculate, and you try to make the best storyline, the best narrative, the clearest narrative you can, with sometimes very little data to go on. You have to be able to piece it together. And that's also kind of fun doing that.
So how can you give me an example of that, of how you would, how do you come up with that?
I'm trying to think of an example for you. For example, I'm now working with the dean on a project of a nurse who everyone should know about, but nobody really knows about. Her name's Henrietta Villaescusa. And she worked for Henry Rival in the Community Service Organization. She was appointed by Margaret Heckler to many posts in the government and was responsible for many instrumental reports on minority health. But nobody knows about her, except those who actually were mentored by her, and especially, in the Mexican-American nurse community, for example, she's known, but outside of that community, very few people know about her. So we're trying to find, you can establish a timeline, you can establish a descriptive thing of what she did when and where, but you don't have that deep dive. It's almost been impossible to get that deep dive in terms of, what drove her. Why'd she go to nursing? what were the barriers she faced? How did she take advantage of opportunities? What did she do with Henry Riebel? I mean, even in his records in California archives, you search for her, she's not there.
Mhm.
So what we're trying to do is piece together a little bit more of a story than she did this, when, and what, because that's technically not history. It's setting her accomplishments and her work within the context of the time period, so a better sense of what it really was like for her to be there. Now, we do have some oral history informants who we're going to start talking to in March, but she's not alive anymore, so we can't talk to her. But we can compare her then to some of the other, if we find any other oral histories of Mexican American nurses. I mean, she was incredibly important for starting the National Association of Hispanic Nurses. So, we're going to have to take pieces and put them together to make a narrative that actually tells us a little bit about her.
What got you interested in looking into the civil rights era?
So my second book was on the nurse practitioner movement. And that was, it's been more than 10 years now that that's been published. And, I started thinking about, all the material I had that I didn't put in that book. And I came upon a photograph that actually Joan Linow had sent me afterwards. And in this photograph was a young woman, a young Black woman, with other white women who were part of the Rochester program. There's nothing in my book really about race. And if we think about all the institutional racism that we're talking about today, and looking at the proportions of nurses of different racial and ethnic backgrounds, I should have been talking about them. So that was part of it, was then searching for where were these other voices in the nurse practitioner movement. For example, I talk about Harriet Kitzman and Joan Linow and Barbara Bates, who started some of the early programs in Rochester. Of course, we all know about Loretta Ford, but at the same time, there's a lot of activity at Rochester. There was Evelyn Tomes in Tennessee, who was opening programs at Meharry, and her students couldn't actually get placements in Tennessee or in any surrounding state, so they would come north to do their placements. She had one of the first mental health nurse practitioner programs, and there are a lot of things like that out there that I did not include in this book, and which I really am going to do in the next revision of it. But so that made me think about, what is it about this institutional racism that we've had in nursing? And I've thought about this for a while. And so the civil rights movement was sort of I fell into this serendipitously, because I learned about a nurse who went south during the summer of '64. Now, we don't usually think about nurses working in the civil rights movement because, John Dittmer wrote about, quote, the good doctors, and there are nurses in there. But if you look at his table of contents, there's not even the word nurses in terms of the book. He wrote about the Medical Committee for Human Rights, which hired nurses to go south to work in communities. Now, a lot of the nurses went. So that's sort of how I got into this, because I thought, here is I would backpedal just a bit and say, it was about the time when we were hearing a lot of rhetoric about how nurses are such patient advocates, and, we're always there for the patient. Well, not always. And I had read about nurses in the segregated South who kept patients out of waiting rooms, who refused to treat either the activists or people in the Black community, depending on where they were. And so that made me think about, well, what were nurses doing this? I knew about the freedom schools. I knew there were nurses teaching in the freedom schools, and I knew there were nurses who went south. Why is it we haven't heard more about this? And then to begin with, civil rights wasn't only happening in the South. So that's why I became interested in the West, the Midwest, and the Southwest, where there's a lot of activity going on. So that's, in a sense, it's not a direct route, but again, a little bit serendipitous when you learn about interesting people, which make you ask interesting questions.
Yeah. And I think that if we're going to overcome any of the challenges that we have today in nursing in regards to racism, then we need to understand the truth of what was happening then.
Mm-hmm. I mean, Joe Lionel always used to say, you need to know the past to understand the present and think about the future. We don't predict the future, but in order to think about how we can make a better future, we have to understand our history, and we have to understand how it has influenced the present, I think. History informs everything we do. I mean, even quantitative researchers, if you look at anything over time, which is what history does, they're doing, in a sense, this is heretical, they're doing historical research. They're looking at change over time. How they develop their questions comes from somewhere. And as Joan Lionel said before, everything has a past. So why is it we're interested in these questions? Maybe there's money there. Maybe there's a way to, increase our prominence, whatever. But I would argue that just about every question we raise in any kind of research we do has a historical foundation. And if you don't understand the context of what you're asking, you perhaps might not be able to ask the right questions.
I never considered it that way. That's a really great way to think about it.
Well, and if you think about it, historians look at context, and context is not just a singular factor. It's everything. I always put it, give it like it's a nest, this context. It's the race, the class, the gender, the economics, the religion that sort of shapes whatever we do. Mm-hmm. And if you can't think about how that's influencing the way you think, again, you may not be asking the right questions. So everything has a context, everything has a past. And if you don't acknowledge it, again, you won't be asking the right questions.
What's next?
I probably have so many projects, which is a problem. It is a problem. But so in May, I'm on my way to Bellagio, Italy, at the Rockefeller Foundation Center there to do an academic writing fellowship with a colleague of mine, Karen Flynn from University of Illinois, Urbana-Champaign. She's not a nurse, she's a historian. She's one of my interdisciplinary colleagues. And we have proposed to write a book proposal on women as activists. Her area of research is on Caribbean nurse migration. Okay. So she's a Black Studies scholar, women's scholar, historian. And so we will work together and write together on that. I'm going to try to revise the nurse practitioner book, bring it up to the future, and also think about how to better address some of the issues, some of the social issues we're looking at. And there's an interesting project, not really quite off the ground yet, but I'm working on with two doctoral students, Raven Ponte and Andre Rosario, on a woman photographer from New York City, white woman, who went south, left her family for a couple of months, and actually produced some of the most iconic photographs of the civil rights era. Her photographs of Fannie Lou Hamer and Ella Baker are really quite famous, but she also took lots of photographs of nurses. And my current idea is to create some sort of digital site for putting these, sort of highlighting these photographs, the activists behind the lens, and then situating those photographs, looking at who is in them, who are the nurses, who are the women, who are activists. I mean, most nurses didn't go south to be nurses. They went south to register people to vote. And they believe very strongly, both, across the race, across ethnicity, and social justice. But once it was found out that they actually were nurses, they were enlisted into the healthcare arena. They built health centers. They treated the activists. There was an incredible amount of stress and violence in the South, and a lot of GI bleeds, a lot of we wouldn't call it this then, but PTSD. And, the nurses down there do describe having flashbacks even today. But they became the go-to people for healthcare for many of the people who they worked with in the community, and also because they had no resources either, and also the activists. They bore witness to people in prison. They visited after Medicare and Medicaid were passed in 65. They visited hospitals to see if they were desegregating. I mean, these nurses did a lot of things to move forward the civil rights agenda. So that's where we are.
That sounds like such an interesting project.
It is. And as I said, I keep finding these nurses where we haven't seen them before. And it's been a really interesting journey. I was just out in Wyoming, and I visited the Heart Mountain Settlement Center. During World War II, they moved a lot of the Japanese from the West Coast into the interior of the country because they thought they were a threat. I mean, there's a lot of racism in terms of how they treated the Japanese Americans then.
Yeah.
And at Heart Mountain, there was a nurse. There was a nurse who was providing most what little health care they actually had in these internment camps. But I have a little bit of a beat on her now. So really interesting way of thinking about, our history as a very complex and not always a very progressive one.
Yeah, it is extremely complex and incredibly fascinating. And I think that it really lends to, like you said, where we're heading, what kind of policy we're going to make, and decisions as a profession moving forward.
Mm-hmm. I have this idea that I would love to write this blog post called "What Took Us So Long?" Because, if you read every single journal we have that comes out, right, there's a study on social indicators of health, on institutional racism, on social justice. Well, you know what? We've been talking about this for over a century. And all of a sudden it's become, I think because of social media, really. And also I think Robert Wood Johnson has probably some credit because of their culture of health movement. But, if you think about, Henry Street Settlement House, where they had lawyers who helped immigrants with their landlords, they had childcare, they had healthcare, they had all kinds of things. I mean, in terms of things that look like what we talk about, addressing the social indicators of health. Mm-hmm. In 1970, I can't remember the exact date, Nursing Outlook has an entire issue on poverty, entire issue.
Wow. With
lots and lots of really good articles on how nurses could be addressing health from a foundation of poverty, in trying to alleviate poverty and how poverty influences health. Mm-hmm. I looked into the next couple issues, no letters to the editor. I don't even know if anybody responded to it, but there's been a group that's been talking about this for a long time, but it's been more individual approaches rather than institutional approaches, I think. And a lot of institutions funding research on social justice, social indicators of health, and things like that. It's become such a hot topic, and it should be. But again, what took us so long? What took us so long to think about the racism in nursing, really?
Do you think it's just because we're conservative as a profession by nature, or just the pretty homogenous makeup of the group? Or there's so many different things. The working class roots, you know what I mean? Mm-hmm. That usually go along with nursing, that very conservative working class line that we tend to see. Mm-hmm. I guess a confluence of all those things.
I think you're right. I think it is a confluence of all those things. I mean, if you think about our major organization, the American Nurses Association, they failed to support a presidential candidate in this last election, even with the incredible moral overtones that could have put them in a different direction. And one of the things is that nurses are really conservative. So if they support one particular candidate, they're fearful of losing that particular constituency, when in fact, they should be leaders rather than worrying about who's going to pay their dues next year. But again, I think when I believe it was I have to think about this, but there was another presidential election where they again refused to support a particular candidacy, when in fact, from what I heard, the main reason they didn't do that was because they were worried about their conservative traditional members. I mean, that's really not the reason to do something. I mean, take a stand, take a moral and value-laden stand on something, because it has implications for all of us.
It does. And I see that a lot in policy work, that it's very easy for people outside of nursing to make policy decisions for us because we don't stand together as a group.
What's interesting is lately, in the last couple of weeks, I've been seeing a lot about this initiative in Congress about capping nurses' salaries in travel agencies. I mean, really, what is that about? Hospitals are, to tell you the truth, institutions are not used to paying for the value, the nursing care value. They're just not. I mean, that's a historical contingency. And so, okay, if you're not going to give your staff the resources they need to care for patients in a way that is not stressful and not consuming, then in a sense, you should learn from that. Frankly, why should Congress cap nurses' salaries? Give me a break. I think there's a lot of historical, like I said, contingency in terms of it being a primarily gender-based occupation, in terms of being in a middle-class occupation, and in terms of not really having a large voice. Although I know the American Academy of Nursing tries very hard to be there for policy discussions and to advocate for policy change. But still, really, that to me, that was incredible. And I'm seeing it on Twitter, but I'm not seeing a lot of discussion anyplace else.
Yeah, that's incredible, because you'd never have that discussion regarding physicians. You'd never have that discussion regarding administrators.
No, I mean, really, locum tenens, you see any, you can't tell me that's not happening in that arena. And there's no discussion about that. So I mean, my own personal perspective is that it's very gender-based and very gender-biased.
That's crazy. But I mean, at the same time, I don't understand how you can cap anybody's salary in a market-driven for-profit industry like healthcare is in our country. I mean, it would be a whole different story if it wasn't a for-profit industry.
Right, because they're really worried about the recruitment agencies, the temp agencies, reaping a profit from this. Well, hospitals are reaping a profit. So why are we worried about temp agencies reaping a profit?
Right.
It is so interesting because, again, it has historical roots in, the 50s and 60s when diploma programs were being phased out. Hospitals were saying, well, where are we going to get the nurses? We're going to have to pay nurses a lot now. And it's like, yeah, you might have to. And even intensive care units were established to keep down costs, to keep down nursing costs. And in fact, it's become the most expensive type of care we have in this country today. So, again, you're going to see historical threads throughout all of this.
So I want to be cognizant of your time. Is there anything else that you would like to touch base on before we go?
We've been talking a lot pretty generally about the value of history and, historical perspectives, again, inform everything we do. I just want to give a shout out to my colleagues, Cindy Connolly, who has written about pediatric pharmaceuticals, showing why it is we really don't know what we're giving kids when we dose them. And, Pat D'Antonio, who I think you've had on a previous podcast, has looked at different ways that nurses, especially around the turn of the century, have created really interesting models of health maintenance, which for reasons that, we know are not sustainable. We really have quite a bit to offer in terms of current policy strategies, and also in terms of, I think, current research endeavors. And again, as I said, Joan always said, everything has a history. No matter what you think you're going to ask as your research question, or what you think you're going to do in terms of your scholarship, everything has a context. And if you don't understand it, you may not be asking the right questions.
Hello, Angela.
Hello, Marion.
How's it going?
It's amazing.
I so very much enjoyed your interview with Dr. Julie Fairman. I loved hearing where she came from, what she's doing now, the fact that she wanted to originally go into forestry service, which I thought was fascinating. The whole interview was just great.
Yeah, she really is a fascinating person and incredibly inspiring. I really enjoyed talking to her about all of the things, really, but specifically about how history really informs what's happening now, and the importance of really understanding the history of nursing if we want to grow as a profession in a really great way. And we have the potential to do that. But unfortunately, I feel like we really don't, as a profession, understand where we came from and what we do. And I think that the work that she's doing, especially learning now, like researching activists and things like that, that she's really bringing forth the true history of nursing. And I hope that everybody pays attention to it because it's so incredibly important.
Yeah, I couldn't agree more.
She talks a lot about the book that she wrote that was 10 years ago now, and sort of revisited it and thought, why didn't she talk more about the Black experience in her research of nurse practitioners? And she's working to remedy that, and I think that's incredible.
Yeah, I really enjoyed the part where she was talking about context and how context plays a big part in how you view history.
Right, exactly. And she makes this excellent point, which again, it's so simple, yet something that I'd never considered before. If you really don't understand the context, if you really don't know the angle that somebody's taking, you don't really understand all the things that are happening. So it's incredible to think about it from that perspective. And it's something that since that interview with her, I've been thinking a lot about. And, with all the things that are going on in the world now, sort of trying to figure out the context and the perspective that people are coming from. And it's really an interesting way to view the world. Amplify Nursing is hosted by Dr. Angela Rosa DiDonato and Marion Leary, and produced by the University of Pennsylvania School of Nursing, with special thanks to Jonathan Zhu for his assistance. Music for the podcast was created by Harper Leary. The podcast is made possible by the Krista and Rich Pinola Fund for Innovation in Nursing.
Follow us on Twitter at Penn Nursing. Until next time, keep pushing over, under, around, and through. We want to thank you for listening to the Amplify Nursing podcast and remind you to subscribe to the podcast on iTunes, Google Play, Spotify, iHeartRadio, or wherever you enjoy your podcast listening. And if you can do us a solid, please rate and review us as well. It will go a long way in amplifying our episodes.